Vitality.
Vitality Unfiltered.
Unfiltered.
With David Bauder.
And we are back to another episode of Vitality Unfiltered. I'm David Bauder, your host today. And with me from Weight Loss and Vitality is Dr. Christopher Reeves, Medical Director, and Nurse Practitioner Stephanie Lattimore from the Washington, D.C. Clinic. Today's conversation, sleep as medicine. It's a very underserved area of focus, and it is actually sleep is medicine when you think about it in a big picture. Sleep problems are everywhere, and they get worse usually in patients as patients age, specifically in women once the perimenopausal areas start to set in. And a lot of times patients will try every single thing to fix sleep, and often their symptoms of lack of sleep or the inability to sleep is often dismissed as a habit problem. And so what we're going to try to discuss today is highlight and point out all of the relative things that are associated with sleep issues and shed some light on it. So what is the hormonal process when it comes to sleep?
So sleep is hormonally regulated by the body. There are willpower limits. There's only so much we can do, as sleep is really driven by this underlying biological process. The circadian rhythms keep our body on a 24-hour biological clock to regulate sleep and wake cycles and sleep and wake windows. The cortisol that Dr. Reeves will dive into a little bit will peak in the morning and lower throughout the day to allow us to wake and sleep. Other hormones, there's many other hormones that play a role in sleep. Progesterone is one of them to, help us calm and sleep in the evening. But ultimately, sleep is regulated by our hormones. Yeah.
When we think, again, the common theme in all of our episodes, we think about these upstream components associated with overall health. And I keep repeating myself over and over again. It's eating correctly, the nutritional aspects of your daily activities, hydrating with water, exercise, and the fourth, and maybe one of the most important, is sleep. And without those four things being constructed or done correctly throughout the day, you are going to have downstream problems. And it's going to usually be solved in today's Western medicine with a medication, all right, to solve your symptom. It's a symptomatic treatment type thing. But one of the big hormones affected with sleep is cortisol. And we did talk about cortisol a few episodes ago, but why don't we go ahead and give the overview of cortisol and how it's related to sleep?
Right. Well, I have to say that, as a medical student and a resident, I completely, and even early years in practice, completely disregarded and did not understand the value of sleep hygiene and how important sleep was.
Was that when you were doing your 60, 70 hours of residency?
Yeah, exactly. Or, where 1 week you're doing nights, next day you're on call, and everything is all off. And I completely undervalued how I was literally shortening my life by not taking sleep seriously. And so after re-educating and kind of doing more understanding about sleep and how, and the effects of cortisol, there's so many things here. So let's see if I can kind of summarize some of this stuff. Well, cortisol, as we mentioned before, as you know, is a hormone that gives your body the energy it needs to function. It's a stress hormone of sorts, but really primarily what it does is that when it's released, it increases glucose levels from your muscles and your liver, to give your body the energy it needs to handle a stressful situation. There's a normal cadence of how cortisol should be released in the body. And if that slope or that curve is off, if it's, like I said in the last episode, was it's a Goldilocks hormone, because it can't be too high, too low, too broad, or too narrow. Because if you, in any of those situations where it's off, you can cause problems. So for example, typically the curve you want is you want to have within 1 to 2 hours of waking up, you want to have the highest peak of your cortisol levels. You want to do things that are going to stimulate that release of that cortisol, so you get that maximum peak effect of the cortisol early to mid to late morning, and then it should gradually decline throughout the day, such that about 4 hours before going to sleep and to the 2 hours after going to sleep, cortisol levels should be at the very lowest. And then, in the 3 to 6 hours after that, you start to have an increase in the cortisol levels because your body's preparing to wake you up. It's that cortisol surge is going to wake you up out of sleep. And then in that 6th to 8th hour of sleep is when you're going to get the massive increase of cortisol that's going to rush to kind of get you up in the morning. So if you are only getting 4 hours of sleep, you're shortchanging yourself that opportune time for that natural rise in cortisol. So that's where you're getting 4 hours instead of 8 hours of sleep. So you're only getting maybe 50% of the amount of cortisol rise that you would normally need. And so that's why sometimes you're waking up sluggish and tired in the morning, sort of thing. Or if you can get between 7 to 9 hours of sleep, you are getting a benefit from that extra hour or so of that cortisol rise. So these are things that just naturally allows your body to be able to have the energy it needs to be able to function. Some other problems with the cortisol is, like, say, for example, naturally for women in menopause, for example, the curve normally kind of, like I said, it kind of gradually declines in the afternoon. Well, in women in menopause, that because of the hormone changes, that curve flattens a little bit. And so they have a little bit more of a delayed decline in their cortisol levels. And that can create a situation to where when cortisol levels are chronically high in the wrong period of time, in the place in the brain where the signal is released, in the hippocampus, decreases the amount of cortisol that's being released overall. And so it gets downregulated. That's why I said it's Goldilocks. It's got to be not too much, not too little. The optimizing the decline of that cortisol in a natural way, so that by the time you're getting ready to bed, you're doing things like decreasing your stimulation, your stress management. We were talking earlier, offline about, like, there are receptors in the retina that detect light. And one of the things that happens when your cortisol is supposed to be low, when you're preparing your body for sleep, is if you have bright lights or that sort of thing, you're stimulating your hippocampus to release, signaling a signal to the adrenals to release more cortisol, so that can disrupt your sleep. Using slow wave light, like red lights or amber lights, slower wave frequency lights, is more compatible with lower cortisol levels as compared to, like, the ultraviolet or the blue lights and that sort of thing. So on your phone, for example, you can set your phone to kind of go to a red shift at night, so that you're not stimulating yourself so much so right before going to bed. I'll stop there. There's more, but I can kind of stop there.
With that, with today's day and age, everybody's staring at a screen. Yeah. And so has anybody looked at this?
Yeah, like, absolutely.
How much? Yeah. Like, what's the connection there?
It can be, you can increase, and I hope I'm not saying this number wrong. I think 20 to 40% increase in cortisol from spikes from looking at, high frequency, like blue, or white lights when you're supposed to be sleeping, or if after you've gone to sleep, you're waking up and you're putting on big bright lights. That's where it can maybe, your cortisol is going to spike, and then you're going to have a harder time getting into that long REM sleep that you need to get restful sleep.
I wonder if now that like, this is making me think of a whole bunch of questions on average patients that we see, or just on the average person that's working. During the day, people work 9 to 5 staring at a screen. So that's they're getting stimulation of their cortisol level the entire time they're staring at the screen.
Yes.
And I wonder, again, I always think in terms of upstream, downstream. I wonder what the long-term effects are of the adrenal glands when it's chronically stimulating cortisol levels all time. Like, does that mean that the adrenal glands will not be able to produce adequate cortisol when you should be resting and repairing your body?
Well, when you have chronic high levels, what happens is you increase your insulin resistance. You have disrupted sleep, which also causes more insulin resistance. And, one of the most sensitive areas in the brain is the hippocampus the hypothalamus, where the CRH signal is released from to stimulate the release of cortisol. It needs functional insulin as well to operate. And so when it's not getting that insulin signal, it's going to, you get the impression that cortisol levels are low. It's going to constantly produce chronic levels of stimulating the cortisol, which leads to the other complications and problems of the fatigue and the burnout and that sort of thing that comes with that.
Hence the type of supplements and stuff to lower cortisol levels. The
ashwagandha and the chamomile teas and meditation, things like that. Stress management, all these things help to reduce the cortisol levels.
I saw an Instagram post that said I work all day and look at a screen, and then in between that I'm looking at my little screen, only to go home and look at my big screen. So it's kind of crazy to think.
Crazy.
Yeah.
I can give an example of cortisol as a hormone dictating sleep. As a new mom, I was up quite a bit the past year in the night. My cortisol from responding to my baby would keep me up, and I said, I can't fall back to sleep. It's hormonally driven. My cortisol has spiked. I'm awake. Looking at my phone now that you're telling me this probably didn't help.
Right.
And I can say all those hours scrolling did not help me fall back to sleep. It's funny when people say they use the TV to put them to sleep. That's kind of surprising if you think about how it affects the brain and the body.
It does the opposite.
Well, now
actually.
I'm wondering what's wrong with me because I can fall asleep at any time. Okay. All right, Steph. So then we move on to one of the other most common hormones associated with sleep disturbances, especially in middle-aged women.
Absolutely. Progesterone. So progesterone is a powerful modulator of GABA. So GABA is the primary inhibitory hormone or neurotransmitter secreted by the brain to promote calming, inhibit the effects of other hormones. Progesterone is crucial for calming in the body, especially during sleep, not only initiation of sleep, but staying asleep. This hormone gradually declines. It's typically one of the first hormones to decline in perimenopause, and it's got a little bit of a slower onset than the other ones. It's not as quite of a stark decline as estrogen, so the symptoms can be harder to pick up on, but difficulty falling asleep for sure, difficulty staying asleep, and all the mood and focus changes associated with poor sleep. So this is very important to talk about with all patients, but especially women, menopause age, and so on. I have a lot of females who say, I struggled with sleep at baseline, and now entering menopause, it's a compounded effect of poor sleep that affects all different facets of their life.
Another thing with that, you also have to lay in kind of thyroid hormone, hypothyroidism, and how that affects sleep as well. You know, hyperthyroid kind of puts you in a kind of a sympathetic state, so you get insomnia because your engine's running too high. Hypothyroidism can cause what they call fragmented sleep, where you have difficulty falling asleep, so sleep latency, and then you have difficulty staying asleep, so you're waking up frequently throughout the night, and so you're never getting that good quality, long, deep, sleep, that restorative sleep, so you're missing that component as well.
And some other hormones that play right into this, right? We got the cortisol, we got the progesterone, we got the thyroid, but there's also estrogen and testosterone. Not as commonly thought about when it comes to sleep, but the estrogen hormone controls the thermal regulatory effects of the body, the core temperature of the body, which if that's off, that's going to cause fragmented sleep. And then testosterone, that's a big player when it comes to when testosterone levels low, a lot of times fatigue sets in. Again, another player in fragmented sleep. If you're chronically fatigued, you're always wanting to sleep. Also, there's a correlation between dopamine and serotonin and how testosterone plays a role in the release of the dopamine and serotonin, which are largely involved with sleep also. I mean, just all the hormones are absolutely heavily involved. And it's, again, no hormone is a silo on any of it. If cortisol's off, probably progesterone's going to be off.
Sure.
And then progesterone's off, serotonin's going to be off. And then all of a sudden you got this downward cycling of what do you treat? And when you really go back to the basics, you manage stress, you get off the screens, you drink, you take ashwagandha.
Yeah.
And
a lot of times, like you can do these non-supplemental kind of changes, and you can see significant improvements with just some slight behavioral changes. Like, for example, like if you have a difficulty falling asleep and staying asleep, maybe don't drink coffee after 12 o'clock or 1 o'clock in the afternoon. Simple things like that. Kind of the light therapy we mentioned before, kind of being sensitive to using kind of high lumen or sunlight in the morning to kind of get that peak where it's supposed to be, and then using slow wave lights and dimming your lights in the evening. These are things that you can do that you can get 30 to 40% improvement without anything else. And then you can add the ashwagandha or the chamomile tea, or if you need more energy in the morning, the licorice root or, grapefruit juice and things like that. And those things can be done, to kind of optimize, the levels.
Why do you think sometimes I'll have patients come in here and let's say, giving an example of a patient, I'll have a patient that had hysterectomy and total. and their physician or their provider will say, you don't need progesterone. And how is there such a breakdown in communication? It's like if, like somewhere along the line, people just don't sleep well if they don't have progesterone. You got to have progesterone to allow the calming effect and that. Why is the clinical model set up with just to discount a hormone that we know contribute to sleep? And if they're not sleeping correctly, we're going to have all these other medical problems.
So when I think of progesterone, your head kind of goes to fertility, right? It's got this connotation that progesterone protects the uterine lining for estrogen and balances estrogen, and it's really a fertility hormone, but it's so much more than that. If you do not have an adequate amount of progesterone, you're not going to have a good time sleeping.
No, you're not.
Yeah, it's so important.
Yeah, progesterone is involved in cortisol production, hugely involved. And progesterone breaks down into testosterone. And all of these hormones and neurosteroids that affect the sleep that you said, the allopregnanolone and the pregnanolone, they're directly correlated.
And it's quite safe. Everything I read, in my research and in my practice, it's very safe to prescribe progesterone. There's really no downside. At higher levels, you may experience some grogginess in the morning, but we'll start low and slow. And I've had really good outcomes from patients who have started on progesterone. It's a no-brainer.
All right, some complications some underlying medical conditions that can affect overall sleep quality. One we think about is obstructive sleep apnea.
Sleep apnea is a big one. Just as I screen every patient for sleep quality, how's your sleep? If there's any red flags with sleep, my mind automatically goes to apnea. Sleep apnea is so common and so underdiagnosed. It's not always your partner or your spouse complaining about your snoring. I have a really good friend, a college roommate who's in her early 30s who was diagnosed with sleep apnea. And as my roommate, I never heard her snoring. So full disclosure.
How old was she?
32.
She was 32. Oh.
CPAP, the whole bit. She had morning headaches. She would wake up with a headache and wouldn't know why. She would have poor focus at work, no energy to exercise, right? So it was all these other consequences of sleep apnea. High blood pressure is a big one too. Blood pressure, uncontrolled blood pressure. So sleep is so important, and apnea is a huge deterrent to sleep.
Hats off to that doc that caught that.
Incredible.
And that's not something you think about it. A 32-year-old female walks in and just I'm tired. The first thing you're going to go to is, I'm going to check the thyroid.
Sure.
Or you're depressed, right? That's the first thing I'm going to go to. And that's, wow.
Yeah.
And wasn't snoring on top of it.
No and not obese by any means. CPAP changed her life.
Yeah.
She was about to start blood pressure medication as a 32-year-old with no other comorbidities, no family history. So
I probably would have caught it there. As soon as I found out, I probably would have caught it there.
You think
I
would be
think I would have got it there. As soon as that patient had the high blood pressure,
Yeah.
or I would have been like, this 32-year-old
something's going on. Otherwise, very healthy.
Well, sleep apnea, it disrupts your quality of sleep, which affects all of these different hormones, because a lot of these hormones, like testosterone, for example, with disrupted sleep, you're going to have decreased testosterone levels just naturally, producing, and you can throw your cortisol levels off, and all these kind of things can happen. Again, I underestimated the value of good sleep hygiene, and how important it is. Such a simple thing can make such a broad difference in your life.
Mm-hmm. So in your opinion, why is it? I mean, what are the main reasons? What makes addressing sleep as a medical problem? Sleep is, poor sleep is not this thing that should just be dismissed as saying it's a bad habit. What are the true reasons that we should be addressing it?
Well, I mean, as I think we touched upon it, is like so many aspects of your physiology and your function are optimized or replenished or released during sleep, and you have to have good quality sleep for some of these things to manifest. And as we talked about, it's cortisol, it's estrogen, testosterone, thyroid, progesterone, all these hormones do so many things in terms of your function, your repair, your immune function. All these things are affected. There's a cascade of problems and events that can happen from disrupted sleep. So it's kind of like a one thing that you can change that could have a big bang for the buck. And something is, even if you start off with just simply, if you're a 4 to 5 hour a night sleeper, try to get 6 to 7. If you're 6 to 7, try to get 7 to 8, and just incrementally increase it and do that for 30 days and see how you feel and see all the things that are going to change in your body, because there's so much that comes from good quality sleep.
I think here, and like in this conversation, it made me realize that it's like sort of like the chicken or the egg, which came first. Mm-hmm. And I mean, when you were talking, literally, I was thinking about, is this chicken or the egg? Because we know that poor sleep or fragmented sleep affect hormones. We know that hormones affect sleep. So which is it, right? And then that leads us right into the evaluation process, right? So when we were doing weight loss, and sleep is a component of weight loss. If you don't have poor sleep, it's going to be difficult to lose weight. So one of the things we do at the clinic, as we all know, is we check hormones. So what's a great, like, what do you do? Like what's a competent, comprehensive evaluation that you do?
So sleep eval looks at all the things that we've mentioned so far, labs, medication review. Mm-hmm. I have a lot of patients on stimulants, amphetamines, and if they're not taking those till 9 or 10 a.m., that's a lifestyle change, right? We got to bump that up because that's just going to keep you awake. You discussed cutting off caffeine after noon. My cutoff is 2 p.m. But if you're drinking caffeine throughout the day, that's going to keep you up. That's an easy fix per se. So medication review, lifestyle, behavior. My favorite sleep improvement, exercise. Are you working out regularly? Did you work out today? Maybe you didn't get an exercise in today, but what a win-win. What a natural way to tire yourself out. Did you see sunlight? So real lifestyle intake, behavior modification, discussion. How's your diet? Eating too close before bed is not always beneficial. Sugary substances before bed, not ideal. So really a holistic approach to sleep evaluation. Blood work is always included in that. Would be my way to help a patient with sleep.
Yeah, we live in Washington, D.C. We've had a horrible winter. We've had a lot of snow. It's too cold to exercise outside. It's 1 o'clock in the afternoon, and I'm going to go get a cup of coffee. I think I'm doing everything wrong.
Yeah, exactly. But there are things you can do to kind of mitigate that. So one thing that, in terms of like, say you eat a relatively low carbohydrate diet, but you're kind of having a hard time falling asleep or staying asleep. Or maybe, again, we're going to these cortisol levels and that kind of thing. Another lifestyle modification thing you can do is for your dinner meal, have a complex carbohydrate that would naturally kind of increase your glucose levels, which would, in the feedback loop, kind of shut down your cortisol production. So that can help to kind of bring those levels down. So it's little things like this, little tweaks you can make that, you're basically, it's game theory, kind of, understanding the physiology and things that you can do to manipulate it, to optimize it, to fit within your lifestyle. So we talked about some people are night owls and they function in their nighttime. So they might do things a little bit differently. Maybe they want their cortisol peak at like 1 o'clock and 2 o'clock in the afternoon and taper down after that. And then they're doing things to kind of shift that works for them. But understanding how this stuff works, from diet, exercise to supplements, that sort of thing, to optimize it to fit your lifestyle is what I think the best way to balance all these things out.
One thing we haven't thought about talking about is what are you guys' thoughts on night shift workers? I know it shortens your
shortens your life.
Shortens your life.
I will say I worked night shift for many years as an ICU nurse, and you can just feel your circadian rhythms flip, the cortisol spikes. You almost use food as like an energy source to stay awake. So a lot of people will put on weight working, night shift, third shift. You're kind of seeking that energy. It's really hard to put yourself to sleep during the daylight hours.
Well, and the other part about it is we are light sensitive beings as well. So the light has something to do with it. And so that's why if you are a night shift person, you really need to get the blackout curtains and really don't let any light in during the day when you're trying to sleep. And you can do things to kind of optimize this, but it's still it's not the best. We're not designed, I think, physiologically to be chronic nocturnal beings. But you can do it.
You can, and you can set that caffeine cutoff. It's just going to be sometime at 2 a.m. or something. It's going to look a little different. You can still try to have those meal times, hit those proteins.
Exactly.
It's just going to look different.
Exactly. Yeah.
All right, team. Great conversation. I think we covered a lot with hormones and sleep. I want to thank both of you for being here today. And just to wrap this up, to the listening audience, just keep in mind that sleep isn't a luxury, it's medicine. And if your sleep is broken or fragmented, your hormones are going to suffer or struggle. If your hormones are struggling, your metabolism is going to struggle. And if your metabolism is struggling, ultimately you're not going to be recovering, and it's going to impact your overall health. Your recovery with sleep is just critical to having a long, healthy life with decreased risk of diseases and high quality of life. I want to thank each of you for listening today. If you enjoyed the show, make sure you click the subscribe button below. It really helps us out, and we will see you on the next episode.
Thanks for joining us on Vitality Unfiltered with David Bauder. Addressing norms, busting myths, and uncovering health realities for a more vibrant life today. For more expert insights and real talk, make sure to subscribe and join us next time.